And that's all we need for the entire day.
Just that, just 1 teaspoon.
Just 1 teaspoon.
At least that's what's recommended for adults, but food scientist Joanne Arcon says most are eating more than double that amount and don't even realize it.
Most of our sodium is coming from packaged and prepared foods at the grocery stores.
Things like bread, sauces, soups, and deli meats. Researchers found 77% of the salt in our diets comes from processed food. Health Canada gave the food industry 4 years, beginning in 2012, to voluntarily reduce sodium in their products. The results are in. And they're disappointing. Almost half of the foods tested did not make any meaningful progress in reducing sodium. Just 14% met their target.
Or 22% of the daily value.
Arcon says governments have been talking about salt reduction since 2007.
It is time to question, do we need to consider having greater, more stringent approaches to sodium reduction? It's an excellent question to ask.
In Britain, the government phased in population-wide sodium reductions in all products beginning in 2003. Less than a decade later, deaths from heart disease and strokes dropped by well over a third. When asked if Health Canada would force food makers to lower their sodium content, the agency told us it will likely opt for product labels that identify foods with a lot of salt. Health Canada hopes the labels will encourage industry to reduce sodium in their products so that they don't have to put this kind of symbol on the front of their package. Adults aside, researchers found that almost all kids aged 4 to 8 are consuming too much sodium. Health Canada says it plans to crack down on the advertising of junk food to children. As for a timeline, maybe 2 more years. Christine Birak, CBC News, Toronto.
Now, Health Canada has also struggled to make headway on another food-related issue, trans fat. Even though a 1995 survey revealed that Canadians had some of the highest trans fat intakes in the world, it wasn't until 2002 that Health Canada even required it to be listed on labels. 4 years later, a group of health experts recommended a ban. But it took until last year for the federal government to finally announce a trans fat ban to take effect this coming September. That's 12 years since the original recommendation.